Thank you for asking me to address your 33rd annual conference today, and I am sorry I can't be there in person. I would particularly like to acknowledge Chief Executive Officer of CRANAplus, Christopher Cliff, President of the CRANAplus Board, Professor Janie Smith, today's guest speakers and parliamentary colleagues, CRANAplus members and delegates, ladies and gentlemen. The Australian Government is prioritising health services to those living outside city centres, and as Australia's first Rural Health Minister, it is a real pleasure to address a group of people as dedicated to supporting our health workforce in remote Australia as I am. As you are well aware, maintaining quality health services to those in remote communities represents some real challenges. Many Australians in these locations are more likely to be of Aboriginal and Torres Strait Islander descent, have higher morbidities and mortality rates, yet have poorer access to health services compared to those living in larger rural communities or cities. Health professionals working in remote locations face the additional challenges of limited infrastructure and facilities, often working in professional and social isolation, without easy access to family and peer support networks. With a focus solely in remote health, the work of CRANAplus over the past 30 years in supporting health professionals in these locations has been vital. Not only in terms of retaining our health workforce in these communities, but by providing opportunities for ongoing professional development through educational courses that their location would make it more difficult for them to access. CRANAplus's Bush Support Services line is a flagship program that typifies your support for remote and isolated health professionals. This confidential free counselling and debriefing service performs an important role for both health practitioners and their families, and around 1 in 5 of the calls they receive are from Aboriginal and/or Torres Strait Islander people. Given the physical and social isolation these health professionals experience, the Bush Support Services line offers a friendly, understanding voice on the end of the line, which is important for general mental health and well-being. Speaking of mental health, you would be aware that the government will announce its plans for mental health reform by the end of the year, as we work to build the best system possible for Australian patients. The National Mental Health Commission's review into existing mental health programs and services found it to be fragmented and disjointed, and tragically, people continue to fall through the cracks. From this review, it was clear that we needed to rethink our approach to mental health and change the focus from a service-centred approach to one where services are organised around the needs of the person. Like CRANAplus, the Australian Government wants to ensure that high-quality healthcare is available for everyone, including the most disadvantaged Australians, no matter where they live. We also know there is no one-size-fits-all healthcare model, particularly for rural and remote Australia, as it depends greatly on the specific health needs of individual communities and the health practitioners available to deliver them. Looking ahead, it's essential that our health system has the flexibility it needs to evolve and better meet future challenges, such as our ageing population, increases in chronic diseases, health workforce shortages, and service changes. Earlier this year, the government established a primary healthcare advisory group, which is currently investigating options to reform the primary healthcare system, particularly in the way it supports those with chronic and complex conditions. Ideally, if we can more effectively integrate and coordinate health services at the primary care level, it may result in better health outcomes for the patient and prevent hospitalisations. In rural and remote communities, this could mean greater flexibility in general practice and other professional health services to better meet the specific needs of the community concerned. A few months ago, the advisory group embarked on an extensive consultation phase, gathering feedback on what works and what can be improved through public meetings, stakeholder consultations, webcasts and online submissions. And I'm pleased to say the response from the public and primary care sector has been enthusiastic, with more than 1,000 submissions received. The information and feedback is now being collated, with the advisory group's recommendations for short, medium and long-term improvements to be presented to government before the end of this year. Primary health care is not the only area of the health system where there is potential for positive change and better health outcomes. The clinician-led review of the Medicare benefits schedule is currently asking health practitioners to identify services that provide no or negligible clinical benefits, or that might actually be unsafe or out of date. The review task force is also looking at the current MBS rules and arrangements which are outmoded, ambiguous, or do not actually help patients to access the MBS services they need. The aim of the review is to ensure that taxpayers are funding an MBS that is contemporary, reflects current clinical best practice, and covers services that are appropriate and improve health outcomes. This process is long overdue. Of the 5,700 services currently on the MBS, most have never been reviewed. It makes sense to undertake a comprehensive, systematic analysis to ensure our health system is more flexible and efficient into the future. While the core focus of the review is on existing services, there is some scope to consider amended or new items. New services will be considered by the Medical Services Advisory Committee, but there will be opportunities to expedite the process. This is an exciting time and presents a fantastic opportunity for the community to get involved with shaping the future of the MBS in rural and remote health. I'm excited about the opportunities that this process affords in areas like remote monitoring and telehealth, areas where we know the MBS hasn't kept pace with modern rural and remote health practice. We recognise that those on the ground, especially those working with disadvantaged Australians or in rural and remote communities, may have a unique perspective of how our health system could work better in these locations. The closing date for submissions to the MBS review is 9th of November, and I encourage you to take the opportunity to provide your input into this process. We expect to receive the Task Force interim report before the end of the year. We hope that our efforts in these key areas, together with ongoing Australian Government funding for professional training and support initiatives, will provide our health workforce with more flexibility and greater skills to tailor health services to the specific needs of these communities, and ultimately help improve the health outcomes of these Australians. I wish you all the best with this year's conference.